Hello, everyone, and thank you so much for joining our webinar today, Adjusting to Holistic Wellbeing in 2021. You know, we at WebMD Health Services, we really believe that health and well-being is more than just having your members just check a box. So whether it's logging steps or eating healthy or managing a chronic condition, having a population that thrives is really all about implementing an intentional and a holistic approach to well-being. And that's exactly what we want to share with you today. We're going to share some tips and ideas to help your member population and their well-being programs. So let's get started. My name is Julie Mallory. I'm the Senior Marketing Events Manager here at WebMD Health Services, and I will be your moderator for today's webinar. Just a few housekeeping things to go over before we get started. So first and foremost, this session is going to be recorded. We didn't share the slides out before, but you will get a recording of this webinar in your inbox in the next few days. So you can go back and you can listen to it again, take notes, or share it with your colleagues. And then we're going to have some time at the end of today's webinar for some questions, but we realize that questions can come up at any time. So you can just use that little Q&A box that you see right there on your home screen, enter in your question, and we'll be sure to get to it at the end. If for some reason we do run out of time, we will follow up with you directly. And then we want your feedback. So immediately following the webinar, please don't close down your screen. We're just going to have a quick survey that's going to pop up. We ask for your time. It shouldn't take more than a minute. And we really utilize this information when we produce our future webinars. So we just want to know what you liked, what you didn't like, or maybe what you want to hear about from in the future. Okay, so that is my housekeeping items. Let's meet today's speakers. So first we have Renee Ruzicka, and Renee is our Senior Director for Client Success here at WebMD Health Services for our health plan market. And she's responsible for leading the strategic account executive team, who in turn drive the strategic direction and overall relationship of our health plan clients. She's experienced customer-focused leader with an extensive background in the healthcare industry, including payer, provider, population health, and digital health tools and technology. And we are so happy that you are here, Renee. How are you?
Hi, Julie. I'm great. Thanks for having me.
Absolutely. And then next we have Jacinta Riedinger, and Jacinta has over 15 years of experience in worksite wellness and health promotion, and she's currently the manager of wellness services at Blue Cross Blue Shield North Dakota. In this position, she leads a team of well-being professionals to provide meaningful and engaging educational experiences, as well as provide well-being advising to employer group clients, individual members, and the community at large. She also has direct oversight over wellness program development and operations, strategic partnerships, and member engagement initiatives. And then in her personal life, she's a former collegiate athlete who enjoys being active and setting an example for a lifelong well-being with her 4 children, together with her husband. Hey, Jacinta, I'm wondering if the college athlete in you trained you for those keeping up with those 4 kids.
Absolutely. I was a runner in track, so it has definitely played out well for chasing kids.
Oh my gosh, can I hire you? Are you available to come and chase my children?
Oh boy. Oh boy.
Well, thanks so much for being here. I appreciate it. And then rounding out this awesome group of speakers, we have Tara Roberts. And Tara is the Senior Wellness Advisor at Blue Cross Blue Shield North Dakota as well, where she has served as part of the employer consulting and wellness team for the past 9 years. And in her current role, she advises key account clients, and she manages the WebMD, which is also called the Healthy Blue portal, and she supports the Blue Cross Blue Shield North Dakota Wellness Vendor Partnerships. And then in her free time, she spends quality time with her husband and her 3 active children. Hey, Tara, how's your running skills?
My running skills aren't as good as Jacinta's, but I did run in high school, so I have a little bit of background there as well.
There you go. That's perfect. Well, the three of you are perfect speakers for today's presentation. We're so excited that you're here. Thank you so much for your time. And with that, Renee, I'll hand it over to you to get us started.
Okay, great. Thanks, Julie. So I'm going to tell you a little bit about WebMD Health Services first. We are part of the WebMD family, and we've been designing well-being programs for employers and health plans for over 20 years. And our mission is really to empower these organizations and their employees and members to improve their well-being through having our personalized and strategic partnerships. We believe that through this kind of thoughtful and very personal approach, that our platform and our services can unlock the potential for well-being in any organization and in their, whether it's members or employees. And the pictures we're showing just give you a snapshot of how we do that. So a little bit more about WebMD. We are uniquely positioned to meet your needs. We are a trusted brand, part of the WebMD brand of companies. And as you probably know, that brand recognition really drives trust, and it brings people back to drive the program participation that we all look for when we set these up. We're a proven leader in the space. We've been an industry leader for over 2 decades, and we've helped already over 60 million people live healthier lives, and that number continues to grow every day. We provide a comprehensive solution that's grounded in behavior change science, and when clients incorporate our proven 9 best practices, the overall program is more effective and drives that reduction in risk that we hope for on the path to improving members' well-being. We've always been committed to the highest standards of quality and security, and we've received over 50 recognitions in industry awards, certifications, accreditations. Some of those include NCQA, multiple digital health awards, the C. Everett Koop Award, and MBGH Best Employers for Healthy Lifestyles Award. But we really support health plans and employers by focusing on these 5 dimensions of well-being. We take a very holistic approach to how we do this and how we support our health plans and employers. And so we combine these 5 dimensions into our WebMD offerings. And you'll see here in the circle, they include physical fitness, emotional balance, social connections, financial security, and clinical management. Now, clinical management is not really a common dimension of well-being, but it is one that's extremely important to us. We really think that if you're not effectively managing a health condition that you have, or if you're at risk for a health condition, it can really impact the other dimensions of your well-being and have a negative impact overall. We think that well-being is personal. We know that well-being is personal, and well-being programs are not a one-size-fits-all for your members or your employee partners. It's really important to look at all of these dimensions of well-being. And so this is where our segmentation capabilities come in. And to us, segmentation is more than just, adding colors or putting logos to a site or to your mobile app. It's really the ability to give you the chance to speak to diverse groups in different ways within your population. We feel that this ability to do this segmentation is really key, and it's built into our platform architecture so that when we create one well-being platform, it really does support all of your segmentation needs. So Blue Cross Blue Shield of North Dakota is going to share a little bit with you on how they've worked with one of their employer groups, True North Steel, to help address some of the gaps in their population health and how they were able to segment their strategies to support this type of a really diverse population. So as we turn it over to them, they're going to tell us a little bit about, as I said, True North Steel. They're going to introduce you to Blue Elements, which is their 6 pillars that they used for growing and really engaging their diverse population. And they're going to show you how the segmentation and the flexibility and customization within their program is really driving results for that population. and how they're creating a universal program that leads to a cohesive well-being experience, and show us some different ideas to support members no matter where they are in their well-being journey. So with that, I am going to hand it over to Jacinta.
All right. Well, thank you, Renee. And hello again, everybody. My name is Jacinta Riedinger, and I'm the Manager of Wellness Services at Blue Cross Blue Shield of North Dakota. And we've really enjoyed a great partnership with the WebMD team over the last couple of years. And so we're really excited about the opportunity to join forces today to share this information with all of you. To start, I would just like to talk a little bit about us at BCBS-ND. We are, of course, an independent licensee of the Blue Cross Blue Shield Association and are headquartered in Fargo, North Dakota. We operate as a non-for-profit insurance company and are the largest provider of healthcare coverage in the state of North Dakota, offering group and individual health coverage, Medicare supplements, stop-loss, and administrative services for self-funded employer groups. In total, we insure or administer claims for roughly 350,000 people in North Dakota with a member satisfaction rate of 95.5%. And our members enjoy access to 100% of the hospitals in North Dakota, 99.6% of North Dakota physicians, as well as access to care in all 50 states and 200 countries as part of our larger Blue system. Blue Cross Blue Shield of North Dakota and our affiliated companies employ more than 2,500 people operating in multiple locations throughout the state of North Dakota. So really, in addition to providing health insurance, well-being is also a very important part of our business. And in fact, it's now the cornerstone of our new mission and vision statements. We recently updated these items, our mission and vision statements, and they're really based on three tactics, which is to simplify healthcare, ensure affordability, and to elevate well-being, which we're obviously in our department excited to see. And we really do see ourselves as a well-being company in addition to a health insurer. So of course, really the purpose of this three-part mission is to position us to achieve our overall vision of a new level of health and well-being in North Dakota and beyond. So that leads us into kind of our view of the different dimensions, which is our blue elements, and we really believe that well-being and living a life well lived are more than just getting enough exercise and eating right. It's kind of like what Renee was talking about. It's having this more holistic approach to one's life and enabling each individual to become the best version of themselves. And so this multidimensional approach has been long-standing at BCBS-ND and is really embodied in our blue elements, which are organized around, as you can see, 6 different dimensions. The ones that we focus on are physical, social, emotional, financial, professional, and then environmental. And we first launched this approach probably 5 to 6 years ago and have continued to build out this framework ever since by incorporating additional partners and offerings that have really helped us bring this to life. So that brings us kind of to our partnership with WebMD and how they've really been key in helping serve as the foundation of this work and helping us to build out an ecosystem of health and well-being offerings that support our blue elements. So as you can see, we've branded our WebMD platform as Healthy Blue, and we position it as a value add to all of our fully insured ASO and individual health lines of business. And we also offer standard rewards packages to our fully insured and individual members, but then allow our ASO groups to have the option to either add or customize their own rewards programs. And so specifically, WebMD has helped us to build out this Blue Elements portfolio and rewardable activities in a couple of different ways. So first, really the platform itself has offered great multi-dimensional content and tools, and especially as we transitioned into WebMD 1, we've been able to leverage the additional daily habits plans to highlight some of our elements in new ways, particularly around social and emotional well-being. And then with the addition of the financial well-being content and the mental health podcasts, we've been able to continue to broaden our reach in those element areas. Also, through the relationships and integration that WebMD has built with Mequilibrium and Enrich and Agile Health, we've been able to expand that reach even further. So, in fact, we were actually able to provide Enrich to all of our membership from July through December of 2020 as part of our company's COVID-19 response benefits, recognizing that financial well-being is an area where people have been struggling during the pandemic. With all of the shutdowns and business closures, we felt it was really important to focus on that throughout 2020. So in addition to these established integrations, we're also excited about the opportunity to leverage some of the newly released API functionality to bring some of our additional external partners into play and allow us to provide even greater visibility and engagement with these programs. And we've also historically appreciated and continue to utilize the external activity upload options to better customize our rewards programs for key clients and make them, as Renee talked about as well, not a one-size-fits-all, but really unique to each client. Which is really a segue into my final point here in that we are also excited about the WebMD One enhancements to the dashboard that allow us to create sort of this more customized dashboard experience for our clients, which can only lead to greater engagement and satisfaction. So as a result of all of these items that I just mentioned, we've really been able to build out rewards program experiences that encompass all of our elements while at the same time allowing each client to create a unique experience for their members. And so I'm going to wrap it up and turn it over to my colleague, Tara Roberts, who will take us through an example of how we've done this for one of our key clients. So Tara, I'll go ahead and turn it over to you.
All right. Thank you, Jacinta. As she mentioned, our ASO key account groups have the option to customize their rewards programs further. And True North Steel is one of those clients who elected to take advantage of that opportunity. They are a family-owned company that started as Fargo Tank back in 1945. They're now called True North Steel, and they've grown and diversified to include products and capabilities that serve industries like agriculture, construction, mining, road and bridge construction, stormwater management, and energy. And when True North Steel came to us for a well-being solution, they were looking for an all-encompassing rewards program that, number one, really streamlined kind of the old paper spreadsheet version they were using and significantly could lighten their administrative burden. They also wanted something that worked to engage employees who sat at a desk all day, as well as those who were working in their warehouses or out in the field. They wanted guided well-being education, fun challenges, easy-to-use tools and trackers that worked across all elements of well-being. But at the same time, it was really important for them to have a program that could incorporate flexibility to include their internal programs and their values. So together, we worked to create the True North Steel Thrive program. And as the Blue Cross Blue Shield of North Dakota Wellness Advisor assigned to this group, I worked directly with their leadership as well as representatives from their consultant, who is NFP. And then they have also established a fantastic network of site wellness champions at each of their locations who assist us in spreading the word, acting as the cheerleader, and really working with all of their employees to stay engaged. When True North Steel launched their Thrive program, they sent out this message to all of their employees, stating that good health or well-being means more than a single blood pressure reading, the number of miles we logged last week on our Fitbit, or a plate filled with fruits and veggies. Instead, it's a complex connection of elements, with each one affecting the next. At True North Steel, we want our employees to be healthy and well, but more than that, we want our employees to thrive. And that is why we built the Thrive with True North Steel Wellness program around these 5 intersecting elements, focusing on physical, emotional, social, financial, and professional well-being. So with the Thrive program, employees can earn up to $500 in total for the program year. They can earn $100 per element. So participants must earn a minimum of 100 points on the WebMD platform, which we call Healthy Blue, within an element bucket to get that $100. It's not an all or none, so participants can choose their pathway, and they might earn the dollars for physical and financial and nothing else, or they may earn all 500. The program kicks off every year on January 1st and wraps up October 31st. So with that deadline, that gives us the opportunity then to provide all necessary rewards reporting back to True North Steel so they can do their payouts and take care of all of the necessary taxation on those wellness dollars before the end of the year. So with it wrapping up in October, then November and December each year are considered blackout periods, and the work doesn't stop in October. We continue to offer a huge variety of point earning opportunities in November and December, and then those are all reported and carry into January of the next year and become part of that program year. I'm not going to go into detail on all the activities that employees at True North Steel can choose from in each element, but instead I'm going to go through each of the elements and highlight examples of things that are housed within the WebMD platform that they can do, as well as things that we are pulling in externally to the program. So physical well-being is really all about taking care of our bodies that we were gifted with and managing our energy. So True North Steel employees can utilize Healthy Blue to complete daily habits plans for diet, exercise, and sleep, and then log their daily exercise minutes. And then they also get external points for things like seeing their primary care provider, and then even getting the COVID-19 vaccine that was added this year as well. So there are a huge variety of physical activities that they can capitalize on and do. Emotional well-being is all about resiliency and building the strengths and skills you need to adapt to the changes that we all know life can bring, and we've had plenty of those to go around within the last year here. Some examples that employees can use Healthy Blue to track daily mood or complete the stress or coping with blues daily habits plans within WebMD. They can also get points for making charitable donations to things like Toys for Tots, school supply drives, the American Cancer Society, all of those things. And then even for something as easy as donating blood, which goes a long way in helping out. We are hoping to work with True North Steel to incorporate the great tools and resources that we know are available through the Mequilibrium program as well in the future. Social well-being is all about making connections with people both inside and outside of work, and we've been able to do a lot of fun things in this category for True North Steel. They can work on social skills by participating in the Invitational Steps Challenge and having some friendly competition with their coworkers, or they can complete the Stay Connected Daily Habits Plan in Healthy Blue, which was a fantastic addition and very timely considering people are feeling a little isolated socially within the past few months. Outside of the platform, they can get points for joining a committee of some sort, for volunteering a minimum of 8 hours out in the community. And one of the big things that we incorporated that was really important to True North Steel is their game changer philosophy. So for True North Steel, a game changer is someone who's a committed, positive, outcome-focused individual, personally responsible for doing whatever it takes to empower their team to succeed. Game changers build trust in themselves and others through dedicated teamwork and self-improvement. By aligning the company culture to the game changer mentality, True North Steel is able to cultivate an atmosphere of positivity and ambition to succeed. So within the Thrive program, employees are able to nominate Game Changers of the Quarter, and then they can also hand out Caught in the Act of Being a Game Changer cards to their coworkers when they see them doing things that represent the game changer mentality. And then for both of those, the quarterly nominations and the Caught in the Act cards, both the giver and receiver earn Thrive points. So they've really seen this program take off and really appreciate the ability to pull that into the well-being program. For financial well-being, we're talking about resource management and security. So True North Steel employees do take advantage of the new monthly financial well-being worksheets that are posted out in Healthy Blue, but then they can also earn points externally for having one-on-one visits with a financial advisor or completing a series of Fidelity web workshops that they have available through their benefits. And we're also really hoping to incorporate Enrich activities into the program to continue to streamline those offerings further in the future. Professional well-being is about finding fulfillment in your work and maintaining a good work-life balance. And actually, to us, this might be the most important element of all of them, because according to Gallup, those who thrive professionally are 50% more likely to thrive overall, and those who work longer doing something they actually love live longer. So we wanted to make sure that we incorporated this element in as many ways as possible. And it was also important to True North Steel to be able to incorporate safety into the wellness program. So we've been able to award points for the LMS safety classes that they do right through their site. And then for all of the classes that they do above and beyond what's just required of them. So we've had a ton of safety classes taken within the last year thanks to being able to pull that into this program. So employees can also earn points for any type of continuing education they do and for participating in some sort of professional organization. And last but not least, the Thrive program allows for creativity through what we call wildcard activities. So I work with the True North Steel leadership and their consultants to make a few approved wildcard activities available each month across the whole company. But then it allows for some autonomy at each of their locations. So their site wellness champions have the ability to use the wildcard activities to do some fun things that are unique to their employees as well. To keep it simple, we created a 10-point wildcard and a 25-point wildcard for each of the elements. And then the site wellness coordinators can present ideas to us of what they'd like to do. We approve them and agree on which of the point values to assign to them. So that gives them a lot of flexibility, and it allows us to award points for fun things throughout the year, like participating in a paper airplane contest on National Paper Airplane Day for some fun social points and all kinds of other things. The wildcard activities were really crucial in helping employees navigate the new normal throughout the pandemic. We've been able to award points for things that help people feel a little less isolated, a little less lonely while quarantined or working from home. They were able to earn emotional points for doing things like 3 random acts of kindness, or social points for reaching out and reconnecting with 3 people they haven't talked to in a while. This could be done through a text, a phone call, or even sending a good old-fashioned letter. And then we also incorporated multiple activities over the last several months that require them to post a picture of some sort to their Thrive with True North Steel Facebook page to keep them all connected and so they can see familiar faces, having fun, and working on the program together while they may be working remotely. The WebMD platform has really allowed us to take a big comprehensive program with a lot of moving parts and simplify it for a diverse working population. So here on this slide, you can see an example of how each of the $100 element buckets are displayed on the site for participants, and then it shows what it looks like for the social bucket being complete for the year. So we tried to keep it as easy as possible. Once they go ahead and click on that Keep Learning, you can see an example of how each bucket lists out the current list of activities available. And then by clicking on More, they see a short description on how to actually go about completing that activity and earning the points. So again, some of the activities are built into the Healthy Blue WebMD platform, while many others can be done outside of the platform and then are loaded in here externally. So it gives us an opportunity to tell them exactly how to go about doing all of those activities. So on this page, you can see there's an example of some of the social activities. You can see how the wildcard opportunities are displayed near the bottom. as well as some of the bonus activities. For example, the Reach Out and Reconnect was programmed for the month of February. So you can see that's expired now, but that was just a special bonus activity during that month. And then on the next slide, you can see the example of the emotional category here. And this shows a few more wildcard bonus activities posted back for January and February. So in January, we kicked off the year by encouraging them to explore a new interest or hobby. And then February, obviously, is our feel-good month with Valentine's Day in there. So we did an attitude of gratitude challenge and some, the 3 random acts of kindness activity. So that just gives you a little bit of a snippet of what some of the options are. Outside of the program itself, True North Steel's also been very appreciative of being able to use Healthy Blue and the WebMD platform to cross-promote services provided by their other partnerships in kind of a central hub through the WebMD One cards. So we have just 2 examples of those here. It was important for them to continue to highlight their EAP program, especially this last year. So we've been able to do a custom card for them to connect to Vital Work Life EAP. And then each month, their consultant NSP has Taylor Stevens, who's their financial advisor, and she supplies us with a video on a different financial topic each month. So the one here you can see is risk management and emergency funds. And we are able to use those WebMD One cards to load those videos that she does each month. And they include quiz questions at the end of them, and then we are able to award points to people in the financial bucket who manage to watch the video and answer all of the questions. The Thrive programs really helped the True North Steel site wellness champions engage employees at their locations in a much more sustainable way than they were able to before. And this is just one example. This is a quote I was given permission to share from Kim, one of our most active site wellness champions. And she stated that since starting the Thrive Rewards program, I feel my overall health has improved. Serving as one of the Thrive champions at our workplace has empowered me to be healthier and participate in more challenges. I enjoy that it focuses on not only my physical health, but also mental, financial, emotional, and professional. The challenges are creative, fun, and easy to access. At our worksite, we do a lot of the challenges as a group, and this generates discussions and helps to keep us all accountable. So Kim, like many of the other site wellness champions, take a lot of these activities, the videos and things like that, and they do them together as groups. And she's mentioned that it's really opened the door for them to have conversations at work that they may never have had before. So they're really appreciating all the opportunities that this is bringing them. So our 4 main takeaways to elevating well-being through this type of program would be, number 1, to know your demographic. True North Steel, for example, has a very diverse working population, and they made it very clear that they needed a program that would work to educate and engage employees all across the board, from those who were really super tech savvy and loved being on the computers to those who actually preferred to avoid computers at all costs. And as you can see, the program we were able to pull in with the WebMD platform allows people who, if they don't want to be on a computer, there are plenty of opportunities for them to do outside of that, but then they have that one-stop place they can go in and find things really easily. Number 2 would be to create individualized pathways to goals. We all know that cookie-cutter, one-size-fits-all programs do not truly move the needle when it comes to lasting change. So participants need to have some sort of choice in the path that they take and the activities that they do to reach their well-being goals. Number 3 would be to allow for flexibility and autonomy. The wants and needs of our clients and society in general are constantly changing, and the program must be able to change with them. This is where the wildcard activities make sense. So for example, we will actually be incorporating wildcard activities around diversity and inclusion in the upcoming months. So it's great to be able to have that flexibility to pull things in a timely manner. And number 4 is get creative and make it fun. So we encourage you to make sure that you incorporate activities that are a little lighter in nature. For example, that paper airplanes, the fun photo contest, and even pulling in, sharing your favorite jokes or memes, things that people might not necessarily associate with wellness all the time, but in the end, they really do make sense and help people to reach their goals. And at Blue Cross Blue Shield of North Dakota, we are extremely grateful to WebMD for providing us with a platform that allows us to do exactly all of these things for our clients. And with that, Julie, I will turn it back over to you.
Oh my gosh, Tara, stop. I'm blushing. No, you're so kind. Thank you so much. Thank you so much for those kind words and all of those really great examples. I was going to say when we were talking about the Game Changer, I was like, I'm going to award Renee, Jacinta, and Tara the Game Changer Award for this because you all just stepped up and you really committed and you made this webinar such a success, and we're super grateful. So thank you guys so much. Before anybody goes, we have tons of questions that have come in. So we're going to take some time to get through those now. I want to start, Tara, maybe I'll let you catch your breath, and Jacinta, I think you might be able to answer this one. How did you go about defining your different segments or pillars?
Yeah, so I would say when we looked at that, we looked at a number of different models and then sort of as a team reviewed those together and you know, identified the ones that maybe were the most meaningful to us and aligned the best with our company mission and vision and where we wanted to go with that. But I would say maybe out of the ones that we researched and were considering, we probably most closely align with the Gallup elements, with the addition of we've added emotional well-being as another category. And then we also are, you know, talking about how, you know, maybe we're evolving with this is our environmental category or element was initially designed to really reflect how do we create environments that support a healthy lifestyle, whether at home or at work or out in the community. And really, I think that one has been maybe misperceived as, you know, just environmental focused and, you know, recycling and those types of things. So we're actually talking about evolving that element into more of a community element and changing that over probably in the next year or so, just to reflect kind of more what our original intent was behind that one. So I think that's sort of the process we went through. And like I said, we continued to kind of evolve as we grow as an organization and into the different programs and aspects that are important to us.
Great, thank you. Tara, I think this question might be for you. Do you utilize the 6 pillars that you went through across all of your employer groups, or is it specific for True North Steel?
Yeah, as Jacinta mentioned earlier on, we have kind of our standard programs that are across all lines of business, and we do really strategically build all of our communication pieces, all of our programs to make sure that they address all 6 elements in some form or fashion and across all of our lines of business. However, it is just our larger key account clients that have the option to really dig a little bit deeper and further customize their program to meet their specific needs, like True North Steel did.
Got it. Thank you. Renee, a WebMD question. How does WebMD work with health plans to segment out their populations? This goes back to what we were talking at the top of the hour.
That's great. Really good question, Julie. Thank you. We work with our health plans in a lot of different ways to help segment. And I think there is actually, Julie, I think there's a resource on the additional resources site there with a link to, it's called Smarter Segmentation for Better Outcomes. And I think as part of that, you'll see a lot of information on segmentation and how the segmentation can actually work for health plans. I think there's a lot of good information there. But we work basically, I mean, we can work across health plans to, you know, help them figure out different communications that will be going to different populations, whether it's within the same employer group or across the health plan, different employer groups and their diverse needs. It will really help to kind of segment the offerings across those groups. different locations within employer groups. So we really do that in a lot of different ways.
Fantastic. Thank you, too, for the marketing shout out and directing people to that post. Thank you so much.
My pleasure.
Tara and Jacinta, I'm going to throw this back over to you. There was a lot of questions that came in, so I'm going to kind of like lump them together here. Are volunteer and charitable donations self-reported? How are these items tracked? Are there forms for each of these submitted internally? You know, like, are the preventative screenings, how are those tracked? Are those via claims, such as like a mammogram? How do you track the wildcard activities and the conferences?
Sure. This is Tara. I can try to tackle all of those.
Thanks, Tara.
Yeah, it's kind of all across the board. The wildcard activities are tracked in a couple different ways, so it just depends on what we happen to do for the month. Some of them are automated right within the WebMD platform, right? So we'll use some of the challenges to pull in there. So during National Sleep Month, we'll probably do the Seize Disease Challenge. Will be something we'll pull in this year, but maybe not next year. Or we do program some self-reported activities in there. So some of the examples I gave, like the reach out and reconnect and the 3 good things, those were programmed in as self-reported, where they had to give a little background and some information in there to get those. The primary care provider, we do require signatures from those. We have a physician form that we use, and they submit those to their site wellness champion. Same thing along the lines of if they do any continuing education or if they are part of a professional organization. Some of those things, it's all about just providing that proof back to their site wellness champion. So a lot of those things that are outside of the platform, we actually utilize the external activity upload template for WebMD, and then we get those passed to us securely through True North Steel leadership and load those that way. I hope that covered all of them.
Yeah. And then also, here's a question: do non-enrolled employees have the ability to participate in the Thrive program?
So for our ASO groups, they have the ability to decide whether or not they want their non-health plan enrolled employees to participate. True North Steel does. So we basically have a mechanism that we use to create wellness only type membership accounts so that we can pull those in. We do those by request. So employees who are not on the health plan, if they want to work on their well-being goals and they want to participate, they submit a request form to True North Steel leadership, which they then send on to us, and we get an account created for them.
Great. What type of challenges are offered other than a steps or activity challenge?
You know, we have used kind of a small variety of challenges. We utilize all of the challenges that are built into the WebMD platform. You know, so the sleep, fruits and vegetables, activity, all of those water challenges. And then the WebMD platform offers us the ability to do custom challenges as well. So I think you saw one of my examples on the slide said a gratefulness challenge. So we created one where they had to go in each day and log something that they were grateful for. So we've tried to pull in challenges related to all elements of well-being, and that custom challenge ability is really helpful there.
Great. And I'll just do my little marketing plug here. If you want to learn more about those WebMD challenges, you can always send us an email at connect@webmd.net, and we'd be happy to walk you through those. Okay, I feel like I earned my place in this webinar now. Great. And then also, is it a manual process to load those activities?
The external activities are kind of a manual process, but it's really, really easy the way that the WebMD platform is structured. You basically just go in and click browse, pull in your file, and load it. It's as simple as that.
Love that. There was a question that came in here that I can actually answer, so yay me. Will this be recorded? Is this webinar being recorded? It absolutely is being recorded and will be sent out in your email in the next few days. So you'll get a whole recording of the email or of the webinar along with the slides, so you can go back and make notes and get any other questions that answers to any other questions that you may have. Let's talk a little bit about metrics here. What metrics are you guys using to evaluate a program's success?
So, Tara, I can maybe start with this, and then if you want to address from a True North field perspective. But I think in general, so our wellness team is part of a larger consulting unit that resides in the marketing division of our company. So we regularly participate in sort of client annual review meetings where we review sort of all of their health plan data, their claims, their pharmacy, what are their top chronic conditions, and we sort of use that information to kind of evaluate and guide the types of programs and offerings that we recommend, and also just use that information on a year-to-year basis to kind of revisit some of these same things and see if there has been a difference, or if there's ways that we can certainly better engage their population to achieve that, which, as I mentioned earlier, a lot of the new functionality in the WebMD 1 release has allowed us to do and increase some of that engagement. And so that's been helpful. But as we all know in this field, sort of that elusive ROI and how do we truly measure it, it's hard to say, but that's kind of the perspective we take on it. And then Tara, I don't know if anything additional that True North Field looks at in terms of their Thrive program.
Yeah, specifically for them, we're just going past their first year with the Thrive program. So it was a big change for them moving to something online, especially for their population. So what we basically set our baseline numbers. They wanted to know, how many people were participating in general and have earned points of any sort at all. And then obviously the amount of people who earned the $100 reward for each of the buckets, and then overall earnings. And I think what we're hoping to see this year is that, obviously physical's an easy one to earn for most people, but we're hoping to see increases in some of the other elements as well. And part of that is making sure that we're providing the right types of activities in there that are assisting people and meeting them where they're at and what they need to work on. So we'll continue to evaluate that over time. And then we'll be starting to do some more surveying of the employees to see what they're looking for and to see how the program has helped them.
Great. One other question here, and sorry if I'm repeating myself or if you answered this one in the self-reporting, but I want to make sure it doesn't go unanswered. Are volunteer and charitable donations self-reported, or are files involved to validate?
Yep, so for the volunteering, they have to volunteer a minimum of 8 hours, and they do have to get documentation for whoever's coordinating that volunteer effort that they did do it. So that is not self-reported. Same thing with the charitable donations. True North Steel in general does a lot of work with charitable donations right from their own company. They do a lot with the United Way. They always do the school drives and the Toys for Tots, and they do that right in-house. So a lot of those come from their own reporting that they have that they provide me. But if somebody does a charitable donation outside of that, they do need to provide some sort of proof back to their site wellness champion.
Got it. Great. And then also, do you guys do similar programs with your own employees?
Yes, we do. Jacinta, I'll let you talk about that.
Yeah, so specifically kind of speaking to the Blue Elements and wrapping an incentive around that, we do have a similar program that's designed around the elements that gives employees options within each element category. So I think overall our incentive program, I believe, calls for 4 different activity completions, but they kind of choose their own path on how they get there. And so there's tasks identified under each element, and then employees select those that maybe are most meaningful to them, or the ones that they know that maybe they need to work harder at to improve their own well-being. So it's kind of a guided path to a guided well-being path that's personalized to each person, and that they get to sort of choose what's most meaningful for them.
Because as we know, well-being is not one size fits all. I love it.
Exactly.
Great. Well, on that note, we're going to wrap it up. I want to thank Renee, Jacinta, and Tara for your time today. Thank you so much. Again, if you have any other questions, you can feel free to reach out to us at connect@webmd.net, or always visit us online at webmdhealthservices.com. Just a reminder, there is going to be that survey that's going to pop up. Just a few questions. It will ask for your feedback on the information that we shared today, and then information you would like to hear from us in the future. Again, thank you all so much. Everyone enjoy the rest of your week. Stay safe, stay healthy, and we look forward to seeing you all on our next webinar. Take care.